Hello, namaste, and welcome to another smashing episode of TLive.in podcast series. TLive.in was founded by Anup Singh, an engineer and a silver medalist from the distinguished IIT Roorkee. Anup was diagnosed with type 2 diabetes in 2011, and since then, he's lived a pill free life by following an LCHF diet and now a carnivore diet. Based on the liver's glycogen holding capacity of 120 grams, Anup came up with the idea of limiting carbs to 100 grams per day on an Indian low carb diet for diabetes remission. He founded India's largest, oldest, and the only award winning low carb platform, DLife.in, in 2014, which has now 3,000 plus combined success stories of diabetes and other metabolic diseases remission. DLife has since been reviewed by low carb stalwarts like Dr. Gary Fetke, Dr. David Unwin, Professor Tim Noakes, and many more, who use the low carb resources on DLife and its 1,200 plus original low carb keto carnivore recipes for the Asian and Indian patients. Anup Singh, along with Shashikant Iyengar, was also the co-organizer of the recently concluded India's first low-carb conference that had 47 top global low-carb icons speaking at the event, including Dr. Shawn Baker. Dr. Shawn Baker is an orthopedic surgeon, a multi-sports world record-setting athlete, and the author of the best-selling book, The Carnivore Diet. In the world of low-carb, Shawn can be reckoned as the carnivore god who's worked to put thousands of people with metabolic conditions into stable remission. He founded the Carnivore Diet community that has many such success stories. He also has a popular YouTube channel by the name of Dr. Shawn Baker Podcast, where he features success stories of people who put themselves on a carnivore diet and found remission. I was featured on Shawn's podcast recently, and it's a total privilege, honor, and fun to chat up with Shawn on my autoimmune condition that I successfully put into remission on a carnivore diet. On Twitter, Dr. Shawn Baker can be found by the same name, Shawn Baker, MD. I am Ira Sahay, a member of of DLife.in and its media head. I'm a metabolic health coach specializing in the carnivore diet protocol. I'm based out of Mumbai, and I'll be your host for tonight. Since tonight we are talking of the carnivore protocol in the context of autoimmune and India, which is largely considered a vegetarian country, where meat eating by the grain-heavy plant eaters is opposed as violence and sin, let me begin this podcast by quoting from one of the most revered and surviving ancient treatises on medicine, Sushruta Samhita, written by the great sage Sushruta, which is considered a foundational text of Ayurveda. I'd also mentioned this on Shawn's podcast. I would just give a prelude before we start the podcast. Quote unquote, an appraisal on mamasa, that is meat is mamasa, in Ayurveda. A close review of Samhitas or the text of Ayurveda revealed use of mamasa as a component of non-vegetarian food source and medicaments. Aja mamsa, which is goat meat, possesses similar qualities to meat of human beings. Mamasa possesses therapeutic value, hence it is used in different therapeutic procedures. Meat from different sources have varied guna karma and should be used accordingly to get desirable positive benefits. Aja mamsa, which is goat meat, is na ati shita, na ati ushna, which is neither too cold nor too hot. It does not lead to dushti of any doshas and is homogeneous with the muscle of the human body. Rishi Sushruta or sage Sushruta has laid down guidelines while selecting the source for mamasa, like Sharira Vyaya, part of the body of the animal, Swabhava, nature, Linga, gender, Matra, quantity, and Sanskara, method of processing meat. If these guidelines are not adhered to, then even Hita Ahara, which is beneficial diet, may result in Ahita Ahara, which is a harmful diet. On that prelude, and putting aside the bias against meat and meat's medicinal properties, let's begin this podcast with Dr. Shawn Baker. Hi, Shawn. Welcome.
Well, hi. Thank you. That was quite an introduction, and I appreciate that. And I obviously do not have as much insight into the Ayurvedic sort of thought that you do, but I know that India at one point was a much heavier meat eating country. I think back in maybe perhaps the 13th century. So it at some point in the history it was there. So
what
anyway,
more
thank you
evidence
for that.
do we want than the ancient text of Ayurveda that is considered largely a herb-based, medicinal text? It has listings from peacock meat to lamb to even tortoise to everything for various elements, including the autoimmune condition. So I just quoted a text from there because it was just a carry forward from our last podcast where we had discussed, and I had so many messages about the same. So, anyways, let's begin this session. Shawn, to begin with, please explain to our audiences what is an autoimmune condition and how does it get triggered in the body?
Well, an interesting question. An autoimmune disease is when the body's immune system, sorts to attack its own cells. How it gets triggered is, some people say it's unknown. I think there is some evidence that shows that it may initially begin in the gut. This is based on the work of people like Alessio Fasano at the Boston Children's Hospital, who proposes that as our gut barrier breaks down, and that does so in response to foods, that allows things that are not supposed to, enter our body to do so. And we see that in bacterial fragments, particles of the environment. You remember our gut, actually, from our mouth all the way through, is actually external to our body. It's considered outside of our body. That tube, we are kind of wrapped around that. And so that is the largest, actually, the gut is the most, the major interface we have with the environment. Remember, our skin obviously faces the environment, but it's largely impermeable. Not much will absorb through our skin typically, but with our gut, we're designed to absorb things, and particularly food and nutrition. That's what it's there for. So we are able to absorb things. However, when it becomes hyperpermeable, we absorb more than we're supposed to. And when these foreign compounds get into our bloodstream and then deposit in different cells throughout the body, our body recognizes that as problematic, and it tags those particular cells, proteins, and other things as essentially foreign. And then that sets up a whole host of different autoimmune diseases, of which you are familiar with at least one of them. But there are skin disorders like psoriasis and eczema. There are gut diseases like Crohn's disease, also colitis, the so-called inflammatory bowel diseases. There are there's just a host of things. Asthma is considered autoimmune in a way. There are some people would even posit that some of the mental health conditions may have an autoimmune component to that. So there are literally thousands of autoimmune diseases that have now been identified. And typically, if you have one of those and you ask the doctor why it occurs, most of them will say, we don't know. They call it idiopathic. Maybe they'll say there's some genetic susceptibilities for certain types, but really the sort of the mainstream Western medicine doesn't really know. They just know what they want to do to treat it, which is basically to suppress inflammation, suppress the immune system via drugs. Either corticosteroids, or now, they have these very expensive immune modulating drugs, which basically kind of shut down parts of your immune system or tamp them down, which may help a little bit, but at the same time, there's negative consequences to having an ineffective immune system. As you might imagine, you're more susceptible to infection, you're more susceptible to things like cancer and things like that. So it is a set of diseases that has dramatically increased, by the way, in the last 50 years in the United States. And I'm sure you're probably seeing a similar rise in India, I would imagine. So, I mean, it's a disease that affects many, many millions of people around the world. And it is something that is increasing dramatically. And I think there's good evidence to show that it does indeed start in the gut.
Shawn, is there any particular reason why we are seeing a sudden rise in the autoimmune conditions? Particularly, do you believe it has got something to do post-COVID or vaccination or something like that? Is it the diet?
Well, I think the diet is definitely part of the problem, and whether or not COVID vaccines contribute or not is unclear to me. That's not really my area of expertise, but anything that's an irritant, in some form or fashion to the gut is going to lead to, sort of a breakdown of this semi-permeable membrane, and it becomes sort of hyperpermeable. And so definitely the modern diet, and there's a group out of Europe that has looked at this fairly extensively with the context of the gut and what makes it permeable and what doesn't. And what they found is a lot of the dietary components that we consume, particularly the modern diet, which is very, very ultra processed to include things like a lot of sugars and sweeteners and grains in particular, can be very irritative to the gut. There's problems with some of these modern oils that we use. I know in India, palm oil is largely replaced, maybe things like ghee in many places. And so A lot of even certain vegetables, believe it or not, can be irritative to the gut for some people. Again, it's a susceptible individual, and it is probably the combination of all these sort of harmful foods together that leads to that breakdown. And then I think it just sort of increases from there, and just kind of gets worse and worse as time goes by.
Mhm. Shawn, India has a number of cases of osteoarthritis and fracture and bursitis and rheumatoid arthritis. That's your area of expertise, being an orthopedic surgeon. Please talk about the autoimmune conditions of RA and in context of the Indian diet, which is largely vegetarian and grain based. How do you see that as a trigger to all of these conditions?
Yeah, well, I mean, if you're talking about some of the autoimmune orthopedic disease, we look at particularly rheumatoid arthritis or psoriatic arthritis. There's some condition called ankylosing spondylitis, which tends to affect the axial skeletons of the spine and the pelvis mostly. So those conditions, again, they are autoimmune. I think the same sort of driving factor is what sets those up. And so interesting, when I was, early in my orthopedic practice, I remember people would tell me that, eating grains and bread and things like gluten would affect their joints, and they felt that was painful. I didn't believe them at the time because that's not what I was trained, and I thought they were kind of a little bit odd, to be honest. But now in retrospect, I've seen, goodness, thousands and thousands of people now, when they remove these foods from their diet, their joint pain has improved significantly, and to the fact that I had patients that I was planning on operating on them. I mean, they had arthritis in their knee that was bad enough to where it was time to do a knee replacement, and we would put them on a dietary change just to get them to lose weight so they would have a better outcome from the surgery. And what I started to find is their pain would go away, and so I would end up canceling their surgery because if they didn't have pain, there was no real reason to do the surgery anymore. So I think that those inflammatory conditions, autoimmune inflammatory conditions, do respond to diet. It generally, if someone's listening and said, "Hey, this is me, and I might want to try it," even osteoarthritis, which is we consider that kind of wear and tear. That's what we've been told. It's just too much weight for too much time, and that's what I was taught. And there's a mechanical reason for that, but even some of the recent literature, just with outside of autoimmune disease, osteoarthritis, has shown that high levels of insulin, which a lower carbohydrate diet can bring down, high levels of insulin lead to inflammation directed by these so-called inflammatory cytokines, which reside in the joint in the so-called synovial cells, or the fibroblast-like synovial cells. And so when they're exposed to high levels of insulin, they secrete these inflammatory cytokines that in turn damage the joint. And so as you bring down that insulin level, and you can do that very effectively with a low carb or particularly a carnivore diet, then that inflammation drives down. And that's what I see clinically all the time. People that have an achy back or achy knees, they go on a diet, and a couple of weeks later, they're like, wow, I didn't notice it, but I don't have as much pain as I had before. The pain on the bottom of the feet, the plantar fasciitis goes away, the back pain goes away. So it's really fun to see that. But yes, specifically with autoimmune disease, we see very much the same thing. And I think autoimmune diseases, you have to be fairly strict. I mean, I think that's pretty clear, because there are, and I know India is very much a dairy, a society that dairy is a heavy part of that. For some people, even dairy can be a trigger, which is kind of unfortunate, because that's a good source of protein and probably a major source of protein for many people in India. So you just have to be careful with dairy, and depending on what it is.
Mm-hmm. So you are saying in a way that the high carb is a trigger, and that I can totally relate in the Indian context, because 80% of the plate is carbs. So I think that's what you're saying, that a high carb diet is a good trigger for the autoimmune condition or conditions like arthritis.
Yes, that can be for many people. Many people will notice that, particularly as they've removed the carbs from their diet and they feel much better, when they add them back in. Say they go to a wedding and have some wedding cake or something, they notice the next day that their joints are swollen and inflamed again. And so it does seem to be that, because we know when we remove them, they get better. When we add them back, it gets worse. And particularly, like I said, very high sugary foods, grains, tend to be. So I think the combination of high insulin and perhaps increasing gut permeability, both of those things are interacting to cause, this inflammatory state, which is indeed painful, as many people know.
Shawn, dairy is also an animal product or an animal origin product. Why is dairy forbidden in the carnivore diet? How does it act in an autoimmune condition? Why is it forbidden in an autoimmune condition, not on a carnivore diet? Sorry for that.
You said dairy, I'm sorry.
Yes, dairy. Why is it
Well,
on the autoimmune conditions?
yeah, so I don't know that it's forbidden, but it is something that people have to be very careful with. Some people will tolerate dairy pretty well. There is something, and some types of dairy are tend to be more problematic than others. And I think probably the most well tolerated dairy product is probably ghee, because as you know, when you make that, it's clarified. You remove all all the proteins and solids out of there, and usually people are reacting to certain proteins is what we see. So there's obviously, maybe perhaps not in India, but in a lot of parts of the world, we have a lactose intolerance, which leads to, people that are lactose intolerant will commonly complain of gut pain, bloating and pain and cramping. And that, again, that irritation probably leads to these permeability issues. There are certain, sort of types of dairy which may favor people more than others. Some people will say, we have this set of proteins, A1, A2, that certain cows provide an A2 variant of this particular class of proteins, which people seem to tolerate better, at least some do. But yeah, I think when you're dealing with an autoimmune condition, I think in my mind, in my experience, is that being very, very strict to include even things like eggs, unfortunately, dairy, eggs, certain types of meat, tend to be a problem. What seems to be the most safe is what's called a ruminant animal, ruminant meat. And so in the context of India, depending on where you are, I mean, obviously you mentioned goat and lamb and buffalo. And then if you're in an area where beef is allowed, those are good sources for, ruminant meat. I think that is the most well tolerated. I talked to a fellow scientist from Oxford University a few years. I was giving a lecture in Malaysia, and he had done immune system sensitivity testing on foods on something like 5 million people over a period of about 20 years. And what he found was the one item that was the most well tolerated across the board was red ruminant meat. Yes. And, some people had dairy problems, some people had eggs, some people had problems with fish, a whole host of plant products, obviously. So it does seem to be the most neutral food for us to tolerate. Now, some people, some people will tell you when I eat, whatever, red meat, my stomach doesn't tolerate it, or it's upset. And I think that's part of the problem is as we sort of age, as we continually condition ourselves to low fat, high carb diets, our gastrointestinal system has changed a little bit. And, it's plastic. It means it can change back. But, like I said, when we're born, well, as you know, most babies are eating animal products, right? It's a breast milk. That's what most infants start on if the mother's able to. And that's, we're set up for that. And to go from that, if you look at studies on mammalian feeding, when they look at all these different animals across the board and they calculate how do we get a big brain and have the sort of the weaning time from breastfeeding, it shows that humans, because the average breastfeeding time of what we call a wild human or indigenous human is about 2.5 years. You take it outside of the modern society context, you go to these remote tribes, they breastfeed for about 2.5 years on average. And then we have this massive brain growth that occurs during that time and for the first 5 or 6 years of our life. And in order to achieve that, sort of in wild without modern interventions, right now we process foods, we make flours and sugars, which are very concentrated. And I would argue that, if you and I were out in the woods and had to gather food, we would not find any flour. We would not find any sugar. We would find whole foods that we would have to break down with our teeth and our digestive tract. And that's how we're designed to do it. And so when we have these modern foods that are ultra processed, super small surface areas, they're more easily absorbed, we can grow our brain. That's why the cereals and the rice cereals are often given to infants, but that's not really how we're designed. We're designed to consume really a sort of a, where do we get the most energy outside of processing? Well, you're not going to get much eating leaves. There's very little energy in that. Fruits are available depending where they are. Now, there's probably more fruit in India than there might be in Canada, but again, that's still a relatively lower source of energy, and particularly the fats that we need. Our body needs fats. We have essential fats. We have essential amino acids. we don't have any essential carbohydrates. I mean, they can be used for energy, and clearly they are. But what our body needs structurally and for development are proteins and fats largely, and I think obviously a diet, that's what meat is, basically protein and fat. And that's one of the other things that people will find is, we've been taught to be afraid of fat. That's going to make us fat. That's going to give us heart disease, and on and on and on. And that is actually, just not true. I mean, that's the bottom line for that. And so we substitute fat for very high energy dense foods. So in India, I know sugar is quite popular, I believe. There's a jaggery or something like that where people consume quite a bit of that. And that's actually, while it provides energy and it provides calories, it's not very good nutrition. There's very little nutrition in that, and it ends up ultimately harming people, I think, in the long term.
Mm-hmm. Shawn, you're answering most of my questions. I'm so glad we are saving time on your own. So I would just come back to one point here. You talked about meat being the safest and the best nutrition even for a child. What is the age at which one can start feeding the child? This is probably an off topic, but this is important. One can start feeding meat or carnivore to an infant while weaning him off breast milk.
In my mind, I view carnivore as a therapeutic tool, right? It's something to fix people with disease. Generally, children aren't born diseased, mostly. I mean, there's obviously exceptions to that, but generally kids are born healthy with a good intact immune system and so on and so forth. Kids can start consuming, basically meat, as soon as you introduce complementary food. So usually that's maybe 6 months. 4 to 6 months is when most little babies start to eat something. You might give them. So instead of giving them, a sort of a carb-based sort of, biscuit or something like that. They often have these little teething biscuits and things like that I've seen. You can literally give them a little lamb bone, with a little bit of meat on it. Let them gnaw on that. That'll help them with their teeth. Now, obviously watch them so they don't try to swallow it, or, have it big enough so they can hold it in their hand and they can start to, and they love it. They will go crazy for it. Babies know. I mean, if you literally put 5 foods in front of the child and you put, maybe some bread, a vegetable, a fruit, and a piece of meat, most often they will reach for the meat and eat that because they sort of intuitively know what their brain needs. And remember, brain development, particularly in that first 2 years of life, is so rapid, and that's where you really want to ensure that. I know India traditionally has a very high rate of stunting in their children, and that's a nutrition problem. It really is. And so, I mean, that if you want to give your kid a huge advantage, from development, from growth, from growing tall, from maximizing their cognitive potential, then including things like meat and eggs and dairy products are very, very helpful. Right.
Shawn, what is the importance of protein for bone health, as it's 40 to 50% collagen? And why do orthos usually give just calcium or vitamin D?
Yeah, it's interesting. As an orthopedic surgeon, I was taught that, our bones are made up of calcium phosphate as part of the structure. But honestly, you're correct. It's about 40%, 45% is type 1 collagen, which is purely protein. It's the most common protein in our body, in fact. And we've always focused on the mineral side of it. And so when someone breaks their bone, you give them extra calcium. And if you're smart, you say, we're going to add some vitamin D to that. And now people will talk about vitamin K2, particularly to prevent the calcium from going to places where we don't want it to go to. But really, protein is the backbone of the bone. And that's kind of a funny analogy, but all of our bone is laid down on this protein sort of scaffolding. And when you don't have enough protein or the correct types of protein, then the overall structure of the bone is lessened. And we see that in people on plant-based diets, people on vegan and vegetarian diets. They have a greater rate of fracture, particularly as they get older. They have greater rates of osteoporosis. Multiple studies have now confirmed that over and over again. And I have actually seen people that have had osteoporosis or osteopenia, so low bone mineral density, go on a meat-heavy carnivore diet or something similar, and they actually reverse that condition. So they actually are able to put a little bit more bone mass on, and that's of course, to that, it's nice to add some sort of weight-bearing exercise. I think it's super important to try to get stronger. I think that helps, you at any age. Doesn't matter if you're 20 or 90. You should be still challenging your body because it will support you better. And that's why protein is so necessary. And again, remember, animal proteins are complete proteins. They have all of our essential amino acids, whereas plant proteins are often deficient. It's very hard to find a single plant source that has all the essential amino acids. Soy is pretty close with that, but soy also has its own problems. So you often, as you know, and probably in the Indian diet, you'll mix plant protein sources. You'll have some sort of lentil with rice or something like that, and that helps. But again, there's still the ratios aren't exactly right. There's issues with bioavailability, so you have to eat even more of that to just get the barely necessary amount of protein. And I know I've seen statistics on India, and if we look at the USRDA, which is 0.8 grams of protein per kilogram per day, and that's very low. That's barely enough to hold off protein malnutrition. I think something like 90% of India does not even achieve that level. And it doesn't matter on the socioeconomic class, even in the more wealthier classes, still protein is a problem. So I think you have to find a better way to get more protein in.
Mm-hmm. So coming back to autoimmune conditions, Shawn, why is the carnivore diet so effective, especially in the autoimmune conditions?
Well, like I alluded to before, I think it's the gut is something that plays a unique role. Now, again, there's a group in Europe that has done extensive testing on gut permeability using something called PEG 400 or polyethylene glycol 400. It's one of the ways that you can assess gut permeability. So what they do, they have people drink polyethylene glycol, and then they see how much shows up in their urine, which means it went through the blood and it's been filtered by the kidneys. And so what they find is people that are on a carnivore diet over a period of time have normal gut permeability. It normalizes the gut permeability. And people that consume other foods, including things like vitamins and medications and antibiotics and these sort of these oils that people consume, sugars and grains and legumes and nightshade vegetables, and perhaps they all seem to increase that gut permeability. So meat is believe it or not, it's a very gentle food on your gut, and you may have experience with, you don't have bloating, you don't feel, sort of irritation in your gut. And I would argue, a lot of people, it's kind of funny, their gut swells up, they become very gassy, they're farting all the time. It's uncomfortable, and they laugh about it, think it's normal. It's not really normal. That is not a normal function. You would, if your chest hurt every time your heart beat, or your lungs hurt every time you took a breath, or your knees hurt every time you took a step, you would not say that's a normal thing. It may be common because people are getting old and say it's just normal aging, but our guts are supposed to design and are supposed to work in a way where it's painless. It should not be uncomfortable for you to eat food. And if your food is causing bloating and gas and discomfort, then that is, there's either something wrong with your gut or you're eating the wrong food. And most of the time people are eating the wrong food.
So are we saying that it's difficult, or is it impossible to achieve the same results, remission of autoimmune disease on, say, an Indian vegetarian diet, which is grain and vegetables and legumes and pulses and stuff like that? What's your
view? I'm never going to say never or always or impossible, but I have not seen it consistently. What I consistently see is for people with autoimmune disease, a carnivore diet is very effective. There may be some people that have achieved that through vegetarian diets. I have not been exposed to that. I've not seen that very much at all. I mean, certainly you can improve your diet if you eat, an American standard, hyper processed food diet in India. You're going to be sick, and by eating a very clean, whole food vegetarian diet, you'll probably improve. Will you improve to the extent that you could on a carnivore diet? I don't know. I'm not sure that you would. I think, particularly if you're still having those triggers with what would be a typical Indian diet, maybe a lot of grain, maybe still some sugary stuff, maybe even some vegetables that are irritative, perhaps not. I mean, it'd be interesting. Like I said, it's always, and I tell people not to trust me, but trust themselves and try it and experiment and see what works for you. And I think if you're going to do a carnivore diet, give it 3 months. I think that's a fair assessment. You'll either start to feel better or you won't. Most people within 3 months, and I collected data on about 12,000 people doing this diet a few years ago. And we found that by 3 months, most people that have an autoimmune condition or some other condition notice, significant benefit by then. So I think that's a fair test.
Yeah, the question was relevant in the sense that since dairy in most cases of autoimmune is also off, and for vegetarians who are not eating meat and eggs and stuff like that, dairy becomes a good source of protein. Now, when that's off the plate, and the person has an autoimmune condition, is that difficult to achieve? Again, I suppose it is. But then, how does one do it if even dairy is off the plate? Uh, Paneer and cottage cheese and stuff like that.
Yeah, I'm not sure. I mean, because, like the paneers and things like that, which would be obviously a very common source of protein there. If you don't have that access, you don't have eggs, you don't have dairy, and you're a vegetarian, trying to get your protein requirements met are going to be extremely, extremely difficult. So just that alone is going to make it quite challenging. And so I don't know how you could easily do that. I think it would be very difficult to design that diet. I mean, just to get your protein requirements, you would probably have to eat massive amounts of food, which would then tend to things like legumes and other things that are common, a lot of carbohydrates associated with those foods, probably a lot of gastrointestinal distress. So I don't know that it's possible. I may be wrong, but I just can't envision a way where it would be easily doable.
Mm-hmm. Shawn, what is the role of fat on carnivores? The common mistake that people make while switching to carnivore is they go lean meat. What is the advice from you?
Well, obviously, if you're not consuming carbohydrates, which I know a lot of people in your audience would be shocked to think that would even be possible, but I've gone basically 8 years without almost zero carbohydrates in my diet, and my brain works fine. Everything works fine for me. So when you have no carbohydrates in your diet, you need energy, right? You got to get energy from somewhere, right? Now you might be able to burn some of your own body fat initially, but that's not going to last forever. And so you have to have more fat than you normally would. Normally, if we look at, say, the American diet, by calorie, it's about 15% protein. I suspect in India, it's even lower. And then the rest is made up by energy, whether it's carbohydrates or fat. And so my diet, for instance, on a sort of average day is about 30% protein, and the rest of it pretty much all comes from fat, which, is a lot of fat relative to what I would eat before, but it's what I need to, have energy. And I think that the concern some people will have is some people initially, particularly early on, they don't tolerate a lot of fat at once. And so you have to sort of be mindful that you might have to have smaller meals, and you might have to have 3 or 4 smaller meals throughout the day instead of, 1 or 2 large meals, which often, one of the things that's unique about particularly a carnivore diet is the profound sense of satiety people get. So they may fill up with a big breakfast of eggs and some sort of meat or something like that, dairy if they tolerate it, and then they're full and they don't want to eat for most of the day, or sometimes not even all the rest of the day. And so getting used to not eating as much or as often is a bit of an interesting sort of phenomenon, because I would argue humans aren't meant to eat continuously. We're not grazing animals. We're not cows and goats. We don't need to sit there and munch all day long. I think that, if we look into sort of, early humans, at some point we were hunters, and we were nomadic and we moved all the time. You can't imagine every 2 hours stopping to eat. It would be very difficult, because you don't have a stove, you don't have pots and pans, you'd have to build a fire, and it's a lot of work. And so I think we're really designed to eat infrequently. So, 2 meals a day is pretty typical for most people on a carnivore diet. But again, during the early transition period, there is only so much fat that your body can absorb in one setting. And if you exceed that, what happens, it just goes right out of you. You'll have diarrhea or things like that. So you have to be mindful on how much fat you consume at one time. The type of fat also has a role. If you're eating a lot of what's called rendered fat. So what is rendered fat? It's basically liquefied fat. It's fat's been cooked down. And why is that different? Because when I consume a piece of meat that has protein and fat mixed together and it's still relatively solid, I chew it up, it goes in my stomach, and then my stomach has to do a job. It has to break it down over a period of about 4 hours, bathing it in acid. And then eventually it turns into liquid and it goes into the first part of the intestine called the duodenum. When you consume liquid fat, say lots and lots of ghee or lots and lots of butter or even, cooked grease, that doesn't need to stay in the stomach. So it goes right past. And if it's a large amount, it goes, a whole bunch gets into the duodenum, and then it overwhelms our capacity to absorb it. And then we lose it. So if it's ending up in the toilet, it's not getting in your body. So it's a waste, right? It's like a waste of money. That's the same thing, interesting with fruits and vegetables and things like that. Most of it we can't absorb, so we have more frequent bowel movements. We have more bowel movements. And so a lot of that nutrition just ends up in the toilet. So you're paying all this money for fruits and vegetables and fiber-based food, and half of it's in the toilet. You think about that. When is the last time you saw a piece of meat actually make it to the toilet? But sometimes you'll see grains and fruit, vegetables sometimes in there, because we can't well digest it, and we're not designed for it. We need, we have a microbiome in our colon that can extract a small amount of nutrition from there. I mean, studies show that primate physiology studies show that humans can obtain something like 4 to 10% of the required calories from fiber breakdown in the gut. That's not enough. A chimpanzee, for instance, is something like 48%. A gorilla is even higher. So we have a very small capacity to get much energy from fiber. Most of our capacity comes from what we can absorb, in the small intestine, which is for sure meat, but also sugar. And so some people would make the argument that, maybe we should eat a lot of sugar, and a lot of people do. We can get energy from that, but it has all these negative consequences that I'm sure you're well aware of.
Shawn, is there like a lot of people express their inhibition in going carnivore because they think animals are exposed to a lot of antibiotics and vaccines. Is there a real danger? Should that be a concern for us?
Well, again, I cannot speak to the agricultural practices of India because I'm not as familiar with that, so I don't know for sure there. I know that on a worldwide scale, particularly, again, in sort of Western agricultural practices, animals are sometimes given antibiotics. That's true. However, slaughter laws, they are not allowed to be slaughtered anytime near antibiotic exposure. So they have to make sure the antibiotic has completely cleared their body. And it's just like if your child was sick with an ear infection or something and you would give them an antibiotic, that antibiotic's not going to stay there forever. It's going to have its period of time, a few days, maybe a few weeks at most. So when the animals are slaughtered, by law, at least in the United States, there's not allowed to be any antibiotic in their system. And if they test the animals, and if they find that there is antibiotics, the farmer is fined. That animal is turned away, and the farmer, often loses privileges to use the slaughter facility. So it's not in anyone's interest to expose you to antibiotics. And the only reason it's typically done is to, if you have an animal that's been exposed to some sort of pathogen. Because just like you would any child, if your child got sick and had an infection, you would want to give that child a medication, right? As far as the vaccines are concerned, most animals are vaccinated, and just like most humans are vaccinated. I don't think the vaccine doesn't show up in the meat in any significant sense. You think about how humans are vaccinated. Most of us get a shot, right? There are a few oral vaccines. There's an oral polio vaccine, a few other things, and that has to be, delivered in a special sort of capsule that protects it from its stomach acid. But most vaccines are delivered through injections. Cows, chickens, pigs, lamb, goat, when they are vaccinated, it doesn't really end up in the meat in any significant quantity. And I know there's concern around mRNA vaccines and what that's going to do. To my knowledge, that practice has not been adopted, at least in the United States, in any significant degree. I know there's no beef cattle in the United States where that's the issue. I doubt that's the issue in India. I don't think so. I know many of the cows. Interestingly, you may know this, but most people may not know this, that India has the largest cattle herd in the world. There are 300 million head of cattle in India. We only have 90 million in the United States, and 100 million of those are buffalo, and 200 million of them are dairy cows and beef cows. And as you probably know, a lot of those are exported. They're raised and sent for export. So I don't think that's a major concern. Vaccinations and antibiotics, or at least it's not in the modern practices that I'm aware of.
Yeah, I think in India also, Shawn, as far as I know, for increasing the weight of, say, the poultry, chicken, they don't use steroids on a mass, because that would require a mass scale kind of vaccination, and that's not feasible. So I don't think that's done either in India. Coming back to a very important question, keto rash, is there something to be worried about?
Well, it can occur. And what is a keto rash? Well, when you first go on a ketogenic diet, low carb diet, and maybe you're not eating a lot and you're exercising, so your body will break down its own fat to perform something to form something called a ketone body, and typically in the blood it's called beta hydroxybutyrate, and there's a couple other forms that go out in the breath and in the urine. Some of it goes out in the sweat. So when we have a lot of ketones and we're not using them yet, like we're inefficient at using them when we first start, it's like, wow, this is a new fuel, I don't know what to do with it. Our cells have to get used to it. So there's a period of time where you waste a lot of ketones, and some of that comes through the skin. And so those ketones leaving the skin for some people is irritative. And so what happens is they'll have it's like a little bit of a chemical irritation that occurs on their skin, and they develop a temporary rash with that. That usually goes away as you get more efficient at utilizing those ketones. You can obviously take yourself out of ketosis by consuming carbohydrates or eating more frequently, perhaps. That might do that. But how often does it occur? Maybe, I don't know, 5% of the time I've seen it in people. I don't see it to be that common, but it does occur, and that's what's going on. There's other reasons for rashes. Sometimes it's completely unrelated. Sometimes it could be, if people start heavily consuming dairy, some people develop a rash. There is a phenomenon of oxalate dumping where people have been consuming a high oxalate-based diet, lots of nightshades, lots of grains, lots of chocolates and things like that. Almonds and perhaps are all high in oxalates. And so sometimes the body will start to lose oxalate, and sometimes that'll come out through the skin. But yeah, the keto rash is real. It's uncommon. It's not that common, and it's usually temporary.
Coming to the last question, Shawn, what would your advice be to people who are suffering from autoimmune conditions and want to transition to a carnivore diet? Anything that would help them do the transition, and how best they can do it?
Yeah, well, I think first of all, realize that if you have an autoimmune disease, and some are worse than others, and some people are quite miserable with that, realize that you have some power here. Don't feel disempowered. Don't feel like there's nothing you can do and you got to wait for the doctor to do something, and you got to hope for the right medication, because a lot of times the medications don't work well. And a lot of times maybe the doctor doesn't know what he's really doing or something like that. And so feel that you have power in this situation, because you honestly do. And like I said, like I mentioned, if you can afford to or tolerate or conceive of doing a sort of a strict carnivore diet for 3 months or so, you can make a tremendous impact on that autoimmune disease as your gut gets better. We see this. Our gut gets better, inflammatory markers start to come down, and then our symptoms get better as time goes. And I know you had that same experience here. There is, like I said, I tell people you have to enjoy it. You got to figure out what you can do that you can enjoy. And so when I tell people to transition to the carnivore diet, there's much variety as you can conceive of. And so in India, I would imagine there's, and again, depending on what you're dealing with, if you're dealing with just kind of, you want diabetes or something, because carnivore has been so good at reversing diabetes, right? So you might have some eggs and some dairy and some different types of meat, whether it's chicken, whether it's lamb, whether it's goat, maybe buffalo, if you have access to that. All of those things, and cook them in a way that you enjoy. Some people will tolerate the spices, I think some of the autoimmune diseases, you even have to be cautious with spices, but I know India is such a spice heavy culture that a lot of people are used to having the different flavors. So you might still be able to do that, but you just got to avoid the grains and the rices and the breads and the sugars and things like that. So you might be able to spice the meat a little bit so you have a little bit of variety, but your body will let you know what you tolerate, and you can kind of figure it out, because it's like solving a puzzle. And the more pieces that are in the puzzle, the harder it is to put together. But if you eliminate the pieces, so there's a few pieces there, it's pretty easy to put those together and make your product. So I like to keep it as simple as possible, but it has to be sustainable. I think the other thing is, don't allow yourself to be hungry, because any diet that leads to hunger, any diet that you don't enjoy, you're not going to be able to sustain that, right? Now, if like I said, an autoimmune condition can be life-altering in a negative way. And, if you go to the modern healthcare system, they're just going to tell you, guess what? You got this disease. You need to be on drugs for the rest of your life. And that's what most of them will tell you. That is, in many cases, not true. And you can change that. And if you can be strict and stick to your guns and really, really focus on this for 3-6 months, you may be able to get rid of that autoimmune disease. And then you might be able to have A lot of people are able to reintroduce a few items in there. So maybe they go very strict, maybe they just eat mutton or something like that for 3 months or something along those lines, and they get better. And then then they can add some eggs to that. Maybe they can add a little dairy. Maybe they can add a little bit of fruit or something like that over time. But you got to fix the problem, and you got to give yourself sufficient time to do that. So try to make it as enjoyable as possible. Eat as much as you need. Like if people ask me, how much should I eat? Eat enough so you don't want whatever, the rotis or whatever you guys like, whatever's your favorite foods over there. Eat enough meat so that you don't want those other foods. And that allows you to sort of change your relationship with it. Because a lot of people, and I'm sure it's no different in India, a lot of people here in the United States eat and they overconsume things because they're bored, because they're stressed out, because it's whatever time I'm supposed to eat, even though they're not maybe necessarily need to eat. If we learn to eat for nutrition rather than for, boredom or stress or things like that, then our body, reacts in the way it's supposed to. And it's not that I don't enjoy my meals. I tremendously enjoy my meals. You should still get pleasure out of eating, right? But you need to eat for reasons of nutrition primarily. And hopefully those things align. One, you like the food, and two, it's providing you the optimal nutrition. And I think that's what a carnivore diet, really does. And it's because we look at, it's particularly in the modern environment. I'm sure if you go to an Indian supermarket, there are thousands and thousands of food products like there is in the United States. We didn't sort of evolve historically with that option. I mean, if you would have gone back even a few hundred years, I mean, you would have what is locally available to me. Now we have this modern transportation where we can bring mangoes to northern Canada in January, and that's just that has never existed before. So we've got this access to all these foods, and not to mention all the ultra processed foods where they're not even natural colors. You've got food that's blue and pink and green, and it's just like, bright green, fluorescent green. I mean, that's not food. Let's be real. It's just not literally food.
Mm-hmm. So, Shawn, can we safely conclude that the best bet, I think in my experience as well, but you're the expert, for putting an autoimmune condition into remission is to introduce the carnivore diet?
In my experience, yes, I would say so. If I had an autoimmune condition, or if I had a loved one with an autoimmune condition, I would do my best to have them and commit to that and support them that. And I think, like I said, 3 to 6 months would be what I would be a fair trial period. Not every single person has solved their autoimmune with carnivore, but a very, very high percentage have. And so I think it is, I mean, again, it's not the only thing. Remember, our gut responds to all the external stimuli. So it could be stress, it could be lack of sleep in addition to. So I think in addition to cleaning up your diet, do those other lifestyle things that are important. Get good sleep, be active, don't be sedentary. Minimize stress to the best you can. Now there's stress as it occurs that, you just can't do anything about it, but to the ability that you can, try to mitigate stress, whether it's through meditation or walking or activity, or just surrounding yourself with good helpful people. I think those things all play a role here.
I think we've come to the end of it because Shawn is a bit tied up on time. But I think we've managed to cover most of the basic concerns of an autoimmune disease, especially in the Indian scenario. I'm sure that would help a lot of people deal with their condition effectively. And if you're still not on a carnivore diet, maybe you could consider Shawn's advice and probably introduce some eggs or something like that to begin with. I would request Shashi and Anup to please come on the screen and.
Yeah, Dr. Shawn, thank you. And this is the second time you're coming for a D-Life podcast. I think you came first in 2020 when there were no audiences. So me and 2 of my friends were there. So thank you very much. And thank you for coming in MHC Metabolic Health Conference also.
Yeah, my pleasure. And thanks for giving me the opportunity, because I think there's so much potential in India. You've got so many people there that probably are suffering from poor metabolic health, whether it's cardiovascular disease or diabetes or, increasing, obesity. It's good to see this has grown. That's wonderful. And congratulations to all of you for persevering to grow this, because I think it is such an important thing. And you will probably help untold thousands and maybe even eventually millions of people because of this. So good for you guys.
Yeah,
So
thank
thank
you.
you. And
Thank
for
you,
your
Dr.
information, we will be hosting the second metabolic health conference shortly, which will be more focused on mental health and neurological health, possibly. Yeah. Yeah. Anup.
Yeah, thank you. Thank you, Dr. Shawn. Thank you for coming.
Enough. Thank you as well. And just on the word of mental health, we didn't really touch on that, but diet 100% absolutely affects mental health. 1 in 7 Indians have a mental health disorder. I just saw recent stats on that. So it's a very common problem, and 100% nutrition plays a role there. The brain is an organ, just like your liver, your heart, your pancreas, your spleen, your kidneys are. It is 100% affected by nutrition. So good nutrition will absolutely affect mental health.
John, there's also a study, a happiness index. I think something called happiness index. And you're right, India ranks quite at the bottom of that. So I think it's largely connected to the diet as well.
Well, I mean, obviously poverty has a role here too, but diet, you cannot exclude diet from this. And I think if most people would improve their diet quality the best they can, and it's a very important investment, and it's like when you think about what do I need as a basic, I think good nutrition should be one of the number one priorities. It's one of the very basic things we have. And a lot of people sort of skip over the nutrition so they can have something else. And I think you cannot shortchange yourself on the nutrition side.
Shashi, can we end the session now?
चलेगा.
Can we end the session? Can we end the recording now?
Yeah.